If anybody has any idea that femtosecond laser is not here to stay, that's only because they have not seen the Catalys in action.
We fell in love with Optomedica right away. There's a lot of clinical differences. The main thing was the OCT guidance with the liquid optics was sort of what was heads and tails above the competition.
And when we received the Catalys system installed and first used it in February of this year. Since then, Man Eye has completed 669 cases with the Catalys. We know we made the right decision.
I've had the opportunity to look over my experience over the last several months now, and what I found really has been a rewarding enrichment to my cataract surgery.
The precision of the system is key, and this is achieved by a very tight femtosecond engine, which is coincident with the OCT. After the integral guidance, then the system is then able to apply the femtosecond laser pulses to the exact and correct positions. So it's coaxial and coincident with the targeting.
Because that means with the full fragmentation pattern we have, which really fragments to 350 microns, my preferred grid sizing, we are able to fully fragment the lens and have recognized that phacoemulsification time, the effective phaco time, was reduced by 97%.
So I looked at phaco energy, and my average cataract grade was about 2.4, and my average CDE during that time of all comers, which included very soft cataracts to very dense cataracts, was 2.3. So we're able to drastically reduce the amount of phaco energy used to basically aspirate the lenticular material.
With the spectral domain 3D OCT, which is a high resolution, and the integral guidance that allows you to place a pre-planned treatment pattern in the cornea, we have shown and demonstrated in over 250 cases that the corneal incisions are extremely precise.
The docking is straightforward. There's minimal suction pressure, so patients are comfortable. Subconjunctival hemorrhages are virtually non-existent. The fluid interface is absolute perfection in terms of avoiding any distortion of the cornea that causes disruption of the ability to do a good, clean capsulotomy. The user interface is magnificent. The laser captures a OCT image of the lens and the anterior segment and shows you two representative sections. You simply look at your presets, verify that it's a good capture and a clean capture, which it almost always is, and then you just start the procedure. A couple of minutes later, you have the nucleus prepared with many, many small little fragments. You've got a clean 360-degree capsulotomy. You've got corneal incisions, and it makes the rest of the procedure in the operating room safe and effective. We think the less trauma to the endothelium, less inflammation post-op.
During this time, I had no radial tears, no vitreous loss, complete removal of material from the eye, and intact posterior capsules. So in terms of safety, I felt this really was a great experience.
And immediately after surgery, the patients look great. On post-op day 1, the eyes are very quiet. There's hardly any cellular reaction, and there's minimal corneal edema.
In terms of working with Optomedica, they've been a fantastic company. They have a fantastic level of support throughout their system in terms of technical support, in terms of marketing support, and they've really been a great partner to work with.
The treatment of the nuclear tissue is just amazing, and in my opinion really represents such a major revolution in cataract surgery that this will be known as the greatest advance since the development of phacoemulsification. It's a very strong statement, but I firmly believe that the Catalys allows us to take cataract surgery to an entirely different level that no other femtosecond laser out there is capable of. If you have any doubts, you've got to see it for yourself.